remember the exact moment that night began to feel wrong. Every ER shift has its strange energy. But this one? It felt like the room itself was holding its breath, waiting for something to unfold. And I had no idea just how complicated it was about to become. If you've ever wondered what it's like to treat someone who lies about everything, literally everything, let me take you through the longest, most frustrating, and ultimately heartbreaking shift of my life. And trust me, you'll want to stay until the end, because what he was hiding didn't just affect him. It affected all of us on that floor. My shift started like it usually did, grabbing my chart, scanning the list of rooms, checking which patients were stable, which ones were circling the drain of chaos, and which ones I'd have to babysit more than medically treat. And right there, in exam room 6, was a new name on the board. A man in his early 40s, brought in by a neighbor who found him slumped outside an apartment building lobby. The note said he complained of dizziness, shortness of breath, and feeling weird. ER translation, absolutely anything. Before I walked into his room, I asked the triage nurse, "What's the deal with this guy?" She shrugged. "He's polite, but something's off. Says he doesn't take any meds. Says he doesn't drink. Says he doesn't use anything. Says he's perfectly healthy, which makes no sense considering he can barely stand." Great. One of those. When I pushed the curtain aside, he gave me this wide, nervous smile that didn't match the rest of his body. His hands trembled slightly, his breathing was shallow, and his eyes kept darting around like he was checking escape routes. And instantly I got that feeling, the one every nurse knows. The "he's hiding something" vibe. You learn to pick up on these things. People lie all the time in the ER. Sometimes it's harmless, sometimes it's dangerous, and sometimes it's catastrophic. "Hey, I'm Emily. I'll be your nurse tonight." I said it gently, hoping he'd relax enough to tell me what was really going on. He cleared his throat. "Yeah, I'm fine. I think I just got lightheaded. Probably didn't drink enough water." I nodded slowly, watching him. "Okay. Any medical history?" "Nope." "Any medications?" "Nope." "Allergies?" "Nope." "Do you use anything recreational, even occasionally?" He shook his head so quickly it almost looked rehearsed. "Never." "Sure. And I'm the Queen of England." But I didn't push. Not yet. People sometimes open up once they feel safe, so I went through the basics. Vitals, blood pressure, oxygen, pulse, temperature. Everything was slightly off, not critically, but wrong enough to raise flags. Then I noticed something subtle, a faint smell. Not alcohol. Not anything obvious. Just something off. A chemical smell, almost metallic. Nurses learn to notice things no one else does. A scent, a skin tone, a tremor pattern. They're clues, breadcrumbs leading to the truth patients refuse to tell you. While I took his vitals, he kept looking at the door like he expected someone to burst in at any second. His paranoia was practically leaking off him. So I asked point blank, "Is someone after you?" He froze, then forced another fake smile. "No, not at all. I'm just tired." Right. I stepped out, updated the doctor, and we ordered labs, an ECG, and fluids. Nothing invasive, nothing scary. Not yet. But when I went back to start his IV, he pulled his arm away. "Is that necessary?" "Yes," I said. "We need labs to figure out what's making you feel weak." "I don't like needles." No one likes needles. But most people don't yank their arm back like they're hiding classified secrets under their skin. "We'll make it quick," I said, keeping my tone calm. It took a little convincing, but he finally let me place the line. And the moment I secured the IV, he sighed like he'd just agreed to something he regretted. It was subtle, but real. Then things got weirder. While waiting for the lab results, he asked if he could use the restroom. We get that all the time, so I unplugged his portable monitor and pointed him to the bathroom in his room. A minute passed. 2, 5, 10. I knocked softly. "You okay in there?" "Yeah, just give me a second." His voice sounded strained. I exchanged a look with one of the techs walking by. Something wasn't right. When he finally came out, he looked pale. Paler than before, and he kept his hands inside his sleeves. Another flag. People hide a lot of things in ER bathrooms. Pills, substances, needles, even symptoms. We've seen it all. But he avoided eye contact like he thought I'd read his mind if he let me look too long. I checked his IV line. It was slightly tugged. Not disconnected, but tampered with. He noticed me noticing and quickly said, "I think I bumped it on the sink." That was lie number 1 I could prove. Before I could respond, his lab results popped up on my tablet. And they were bad. His kidney markers were off the charts. His electrolytes? A disaster. And his liver numbers were so abnormal the doctor actually blinked when he saw them. There was no universe in which this guy was perfectly healthy, with no meds, no issues, no history. The numbers didn't just whisper a lie, they screamed it. We walked back into his room together. The doctor asked him calmly, "Are you sure you're not taking anything? Any supplements? Any herbal remedies? Anything purchased online?" He shook his head. "No, nothing. I don't mess with that stuff." Another lie. The doctor exchanged a look with me. One of those silent ER conversations that happen without words. He's lying. We need the truth now. The doctor pulled up a chair and spoke clearly but kindly. "Your kidney and liver numbers are dangerously abnormal. This isn't dehydration. Something is affecting your organs. If we don't know what it is, we can't fix it." The man swallowed hard, then said, "I'm fine. I just need to go home. I don't like hospitals." He tried to stand. He didn't make it 2 steps before his legs buckled. I barely caught him before he hit the floor. His skin was clammy, his pulse racing. He was crashing, fast. Whatever he took, or whatever he exposed himself to, was now hitting full force. We moved him back to the bed, put him on a full monitor, started fluids, prepared meds. He kept insisting he was okay, even while he could barely lift his head. I've had stubborn patience, but the level of denial here was something else. Then the situation escalated. His heart rhythm started doing something irregular. Not immediately dangerous, but concerning. Enough that we needed more information. And fast. The doctor calmly asked again, "What did you take? We're not here to judge you. We're here to keep you alive." He stared at us, eyes wide, chest rising and falling too quickly, and finally said, "I didn't take anything." Lie number. Honestly, I lost count. At that point, it wasn't just frustrating, it was dangerous. His life depended on honesty, and he refused to give us even a breadcrumb. Patients lie out of fear, shame, panic, pride. I get that. I really do. But there's a line between hiding something embarrassing and hiding something life-threatening. While monitoring him, I noticed something strange. A faint discoloration on his fingertips. Not dirt. Not ink. More like staining from chemicals. When I asked about it, he tucked his hands under the blanket and muttered that it was nothing. Then he said something that made my stomach drop. "Can I get some privacy? I don't like being watched." No, absolutely not. I stayed with him. You don't leave a patient this unstable alone. He became increasingly agitated, restless. At one point, he tried to sit up and remove his monitor leads. When I told him he needed to stay connected, he snapped, "I told you, I'm fine." His voice cracked at the end. Fear. That's what it really was. Not anger. Fear. But fear of what? Then things spiraled. His blood pressure tanked. His heart rate spiked. His oxygen dipped. We hit the call button. The doctor rushed in, and suddenly we were in full emergency mode. I was adjusting meds, opening fluids wide, grabbing equipment as the doctor issued rapid orders. And through all of it, he kept saying the same thing. I didn't take anything. I didn't take anything. It became a mantra. Like if he repeated it enough times, it would become true. But the truth was, sitting right there in his labs, his vitals, his skin tone, his tremors, something was destroying his body from the inside out, and he wasn't going to admit it. While helping stabilize him, something fell out of his pocket. A small, crumpled piece of plastic. I froze. It wasn't a pill bottle. It wasn't medication. It was... I bent down to pick it up, and the moment I saw what it was, everything clicked. And that's when the night went from confusing to terrifying. Because the thing he lied about, the thing he hid from all of us, wasn't something small. It was something that put not only him, but our entire team at risk. And before I could confront him about it, his condition took a turn so sharp it still makes my chest tighten remembering it. When that small piece of plastic hit the floor, I knew instantly what it was. I'd seen it before, too many times actually. A tiny, crumpled packet with residue inside. Not something you'd pick up at a pharmacy. Something sold in unmarked bags, usually exchanged in places people don't want to describe out loud. It wasn't the type of thing patients proudly talk about, but it was exactly the type of thing that destroys organs fast and silently. I picked it up using gloves, keeping my face neutral so I wouldn't alarm him. But he saw my expression anyway. His eyes widened, and suddenly he looked like a kid caught with something he shouldn't have had. His breathing grew fast and shallow, panic taking over. "Where did that come from?" he said, voice cracking, clearly desperate to pretend it wasn't his. "You tell me," I replied gently, not accusing, not judging, just offering him one last chance to be honest. But he shook his head again, harder than before. "It's not mine. I swear. I swear it's not mine." And then, he broke. His pulse shot up. His oxygen dropped further. His muscles tensed in waves like his body was fighting itself. The monitor started alarming non-stop, that dreaded chorus of beeps that every ER nurse hears in their nightmares. The doctor rushed in again, this time snapping on gloves before I even said a word. "What happened?" he asked. I held up the packet. He didn't need any more explanation. His eyes flashed in a way I've only seen when things are about to get messy. We worked fast. I pushed meds, adjusted the fluids, increased monitoring. The doctor gave orders rapid fire, his tone sharp, focused. But even with everything we were doing, the patient's body was spiraling faster than we could stabilize him. His heart rhythm flickered into a pattern that made my stomach twist. His blood pressure sank to a level that barely kept him conscious. And finally, he whispered, Okay, I took something." His voice was thin, fragile, like it was fighting through fog. The doctor leaned closer. "What did you take? We need truth. Now." He looked at both of us like he was ashamed to even say it. I mixed stuff, a lot, more than I should have. I wasn't thinking. He didn't specify what stuff meant, but the residue in the packet and the lab results told us more than enough. His organs were reacting violently, and the crash he was experiencing wasn't slowing down. It was accelerating. I wanted to be angry at him for lying for hours. I wanted to ask him why he thought hiding something that serious would help him. But the truth is, in moments like that, you don't get mad. You just work. You just focus. You push everything else aside and do everything in your power to keep someone alive, even if they've lied to your face 10 times in a row. We called respiratory therapy. We prepared additional meds. We paged specialists. The room filled with people, all moving with practiced urgency. I stood at the head of the bed, keeping him calm, talking him through each new sensation. His eyes kept searching mine. Not in fear anymore, but in regret. "I didn't think it would hit me like this," he whispered. "It's okay," I said softly. "Just focus on breathing. We're here." He nodded weakly, and for the first time since he arrived, he stopped lying. His walls dropped, and he just surrendered. But unfortunately, the truth came too late to stop what was already set in motion hours before. His heart rate spiked again. Then it dipped. Then it spiked once more. He groaned in pain, clutching his abdomen. His body was working overtime to stay functional and losing ground with every passing minute. The doctor ordered more labs. When they came back, I felt my stomach drop. The numbers were worse, much worse. His kidneys were failing faster than before. His liver enzymes had skyrocketed. His electrolytes were all over the place. It was like watching a building crumble frame by frame, knowing you couldn't rebuild it in time. He looked at me, exhausted, barely conscious. Can I just sleep?" I shook my head. "Not yet. Stay with me a little longer." His eyes watered, and he said something I will never forget. "If I tell you everything now, is it too late?" I didn't know how to answer. I didn't want to lie. I didn't want to give false hope. So I told him the truth, gently. "We're doing everything we can, but we need all the information, right now." He nodded slowly, then whispered the whole truth in pieces. What he'd taken, how much, when, why. It wasn't a glamorous story. It wasn't dramatic. It wasn't even rebellious. It was sad, lonely, desperate, and incredibly human. But it was also too late. While he talked, the alarm started again. His breathing grew shallow. His body trembled. His skin lost its warmth. The doctor rushed back into position. Another round of intervention. Another attempt to stabilize him. But his body was done fighting. I won't describe the last moments in detail, because there are certain things YouTube doesn't allow me to say. But I will say this. We fought for him. Hard. All of us. Nobody gave up. Nobody stopped trying. Nobody walked away thinking, "Well, he lied, so whatever." That's not how healthcare works. When everything was finally over, I stepped out of the room and leaned against the wall. I felt drained, physically, emotionally, mentally. Not because of the outcome, but because of the journey, because of the lies, because of how avoidable the entire night could have been if he had just told the truth from the beginning. People imagine the ER as a place of chaos, drama, adrenaline, and sometimes it is. But the real frustration? It comes from the secrets, the half-truths, the things patients hide because they're ashamed, scared, or convinced we'll judge them. We're not here to judge. We're here to help. But we can only help if we know what we're fighting against. And in his case, we didn't know until the very end. I still think about him sometimes. Not out of anger, not out of sadness, but as a reminder of how fragile people are, how complicated, how human, and how honesty, simple, raw honesty, can be the difference between life and loss. So if you ever find yourself in an ER, scared and unsure, remember this. We can work with anything except silence. We can treat almost anything except secrets. The truth is messy, but lies can be deadly. And that night taught me something I'll carry for the rest of my career. People don't lie because they're bad. They lie because they're afraid. But fear doesn't save you. Truth does. Thank you for staying with me through this story. It means a lot that you're here listening to what really happens behind those ER curtains. And if you want more real stories from the front lines, told by someone who lived them, make sure you subscribe, like the video, and share it with someone who loves true medical stories. Your support genuinely helps this channel grow. Thank you again, and take care of yourselves out there.